What we need is not more medication, but more education, because the best prescription is knowledge. This is Exposé coming to you live from Lagos, Nigeria, every Monday on Instagram, YouTube, and Facebook simultaneously. I'm your regular host, Tony Akinyemi. Don't forget, what we need is not more medication, but more education, because the best prescription is knowledge. Wow, good evening. This is another wonderful time we're going to have today on Exposé. I'm your regular host, Tony Akinyemi. We are dealing with medical systems in this series. We're talking about allopathy, conventional medicine. We're talking about osteopathy. We're talking about naturopathy. We're talking about homeopathy. We're talking about chiropractic medicine, traditional Chinese medicine, African traditional medicine, and various other modalities. And we want to see how we can bring the best of all of these together in integrative medicine, functional medicine. And I promised you that we'll be interviewing experts in all of these modalities to bring their experience and their knowledge, their wisdom, their understanding, their training to the table, so that we are exposed to all of these information, important modalities out there that we can access from time to time when we do need them. And we are honored to have a very big fish with us who has worked with the FDA in the USA, who has worked with one of the giant pharmaceutical companies in the world, who has background in veterinary medicine, in human medicine, training in toxicology, and partnering with several other people who are pharmacists, who are specialists in internal medicine, certified in ozone therapy, and various other therapies. I mean, it's an honor to have Dr. John Tor with us in part 2 of this interview. Part 1 was very awesome, and I believe part 2 will be explosive also. Once again, Dr. John, you're welcome to this program.
My pleasure, Reverend Tony.
Thank you for obliging us. Today we're going to progress a little further in the modalities that you have in your clinic. And for those who may be joining us for the first time, Dr. John lived and trained and practiced in the USA. He trained as a veterinary doctor in Nigeria and then relocated to the United States and did further training, and has worked and lived in the USA for about 3 decades before deciding to come back to Nigeria to set up and bring back home the things that he's learned and been exposed to over there, so that we in Nigeria in particular don't have to travel to the USA to access these services. He has decided to bring it home to all of us, and he has started with his partners a clinic in Abuja, in country. He will give us more details about that as we go on. And in part 1, he has told us about some of the various modalities and treatment protocols that they have in-country clinic. He mentioned something like, oxygen bar in our first conversation. He mentioned Undermed. He mentioned intravenous infusions, nutrition, and what have you. And those are the things I want him to touch upon today. We will take them one by one. Maybe we should begin with ozone therapy. Ozone therapy. First of all, what is ozone? Number 2, what are the applications, medicinal applications or medical applications, I should say, either for prophylaxis or for therapeutics or for whatever. What are the various uses of medical ozone, and what kind of people can benefit from ozone therapy? And then how is ozone administered? I mean, my understanding as a layman is that ozone is a gas. How do you administer it, to people to benefit from it medically?
Well, thank you very much for that question, Reverend Tony. Let me start off by explaining the concept which most people don't understand. or even those who have the knowledge, they take it for granted. You see, God is so wonderful in his creation. You may ask, what is ozone? The simple answer, ozone is a gas. Now, how does this gas come about? To go to our elementary biology, as we were taught, all the green plants, they undergo a process known as photosynthesis.
Right.
The end product of photosynthesis is what? Oxygen.
Mm-hmm.
That is how the plant release oxygen onto the universe
Right.
that we take and breathe, that we live. If this oxygen were allowed to be like this, it will saturate the universe. So once this oxygen gets to a saturation point, it starts rising up.
Right.
It goes up to a distance of 26, miles, and then it encounters the sun's UV rays. These UV rays, if it is allowed to come down on us on earth, it will perish us, we will be perished. God is infinite mercy. Once that oxygen reaches upstairs and forms a stratosphere, the UV rays now will strike. Oxygen is O2.
Right.
Joined together by a double bond. The UV rays will strike that double bonds and split it. Then you have single oxygen atoms.
Atoms, right.
Three of these oxygen atoms, when they unite together with a single bond, that is ozone.
Okay.
That's why you hear about ozone layer, ozone layer, ozone layer. So, but I'm not talking about ozone layer, but I wanted you to have this understanding. And
right.
Once that ozone is formed, it is higher than oxygen.
Mm-hmm.
So it starts descending onto the earth. It comes out when you see when it rains and it thunder, you hear ozone, you can perceive ozone odor.
Yeah.
It is and when ozone comes onto the earth, that is what actually cleans the environment.
Right.
That is the use of natural ozone. But however, you had specified it by medical ozone. What is medical ozone? By this same concept that I had explained, that God in his infinite nature put in place to protect us from ultraviolet rays. We harness that knowledge with oxygen, what we call medical oxygen. That must be 99% or above pure oxygen.
Right.
This oxygen is now passed through what you call an ozone generator.
Okay.
The ozone generator has a UV rays. What would the UV rays do to the oxygen is to split the double bond oxygen and convert it to a single atom, oxygen, three of each combined. That is how we form medical ozone. Since you started with oxygen, you are ending up with medical ozone. So I am glad you've asked this question. A lot of people don't understand. Then they say, oh, ozone, when they hear ozone therapy, they don't even know about the ozone therapy. They say, oh, we know about ozone layer. Even so, this ozone you are getting is medical ozone, is from pure or 100% pure oxygen. So we're not giving you air. Some people will say that, yeah, when you give air, you have impurities that will cause embolism and this. Have I described that you are giving people air? No. You're giving people medical ozone, pure ozone. So if you don't know, let it be known on today that is how medical ozone is, produced. So it's pure distance. And if you look at it now, how is ozone administered? There are 23 different ways of administering, ozone.
Mm.
And let me step back a little bit. How is ozone important? Because ozone is oxygen is just supercharged oxygen.
Right.
Once it gets into the body, it reacts with the amino acids and small peptides to form what you call ozonides. Okay. That ozonides are able to be driven straight into the cell, particularly the mitochondria, which is the powerhouse for production of this. Then ozone and then oxygen is delivered into the mitochondria to production of ATP.
Right.
That is it. 23 different ways, but the common ones we use here, ozone can be given intravenously. Okay. If you go there, and then you see that is what we call direct intravenous, ozone. You hear that, no, when you give this directly, it will cause air embolism. I'm not talking about air. I'm talking about ozone. Yes, I'm talking about ozone. So we give it DIV, so it goes directly into the blood system. Also, we give it through, there is what we also call auricular ozone for cases of dementia, some, memory, degenerative problems.
Okay.
We give through the ears. There is auricular ozone. There is also what we call the rectal insufflation.
Okay.
Ozone can be through via the rectum through a special tube. Right. Ozone can also be given through what we call ozonated saline. You pass ozone through, bubble ozone through the saline, and then give it,
intravenously.
Intravenously. Right. Ozone can also be given through just water. There's what we call ozonated water. Okay. It is very good. So these are the different ways that we can give ozone. Remember, I said there are 23 different routes that we can give ozone, depending on the protocol. And let me also emphasize, when you give it DIV, people will say, yeah, it will cause some problem. Or if you go on there, you Google it, there is some kind of bad publicity.
Right.
Don't give it. What do you mean? If you don't know what you are doing, look, the kind of needle that we give, the GIV, that is the direct intravenous, ozone therapy, you've never seen it. It is a very, very tiny needle. It is of the size of a proboscis of a mosquito.
Yeah, I saw one the other day.
Yes, that's what we call the butterfly needle. So with that kind of needle, and you're given at a very slow rate of 2 cc per minute, how can you create air embolism? And again, you are not giving air that contains mixtures like
other gases.
Nitrogen, to find nitrous oxide that cause all sorts of problems. You're giving pure ozone, pure oxygen. So this is what ozone, how it is, produced, the purity content, the different routes that it can be administered, then the benefits. Come to the benefits. Remember earlier I said, disease is nothing but decreased ability of the body cells to utilize, oxygen.
Right.
So in the state, there is lack of, oxygen. The cells cannot produce ATP as from the mitochondria. So once we give this, ATP is produced immediately. So the cells get energy. They are energized. Right. Ozone is to stimulate the immune system. Ozone is also anti-inflammatory. It also stimulates the flow of the lymphatic, flow that leads to immunomodulation, better immune, system. Now, the clinical benefits. Right. Remember, I said disease is nothing but decreased ability of the body cells to produce oxygen or utilize
oxygen.
So if you give oxygen in any disease, the cells are able to pick up. So if you look at the list of conditions that ozone covers, is just, there is no limit based on this simple and basic, understanding. Let me also, before I go into this, the Queen of England, one of the reasons why they believe they live that long is they have ozone, the Royal Ozone, College, Royal College Ozone Hospital. This is what these people are taking. Ozone was first discovered in Germany in 1870s. Today, if you go to Germany, about over 7,000 German doctors prescribe ozone therapy to over 100,000 patients daily. At every corner, Germany, you have ozone therapy. So this is what ozone therapy, one of the dramatic benefits that you can see with ozone is in case of sickle cell.
Okay.
Patients coming in sickle cell crisis, 5 to 10 minutes of ozone, you find the person getting up and smiling with you, Reverend Tony.
Wow.
We have seen,
we've
done it, we are doing it. So now tell me, what else? If people don't know, they should also find out. Let me use this opportunity to make an appeal. Let's be open-minded. Especially the professionals, be open-minded. Even during this, case, COVID-19, You can see countries that have used ozone therapy, Spain, Italy, go up in the Google and then check. They are published, studies that they've used ozone therapy to help. And I'm not making prescription here. We're just discussing things for purposes of knowledge, exchange. I'm not making prescription of any kind.
Right. Thank you so very much. I mean, from my own personal, little research here and there, I have come to understand that low level of oxygen in the body is a major, major challenge when it comes to well-being and health. And whatever can boost or increase oxygenation definitely would benefit the body. So ozone therapy happens to be, like you have explained, one of those modalities to increase the amount of oxygen in the blood. And you know that even in COVID-19, one of the things that kills the people who come down with disease after SARS-CoV-2 infection is hypoxia. They go into hypoxia. And once you can elevate the oxygen level, definitely you can save a life, right there. So thank you very much for that explanation. We are going to have a short break right now. And then when we are back, we will now talk about your oxygen bar. What is the difference between the oxygen bar and the ozone therapy? Don't go away. We'll be back shortly.
My name is Olanike Aladeshuyi, a graduate of Rafa Institute of Healthy Living, a school run by Reverend Tony Akinyemi, where we are taught how to take care of our health using basic healthy living principles. My coming into contact with the school has changed my life for the better. Prior to that time, I had been diagnosed of arthritis. I had pains all over me. I had difficulty in breathing. But since I decided to take the principles taught in the school seriously and I followed them, I discovered that my health has improved. I am free of pain. My breathing has stabilized to such an extent that I can run a gym. Can you beat that? So, I want to invite you. Come, join us at Rafa Institute of Healthy Living. Let's learn together how to reverse supposedly irreversible diseases using nutrition and lifestyle. All are basic principles. Your life will not remain the same again.
Well, welcome back. This is Exposé, brought to you by the Shepherd's Flock International Church. Our headquarters church is at number 18 Shogunle Street, Abule Onigbagbo off Mobolaji Bankantone Way, Ikeja, Lagos, Nigeria. And I'm your regular host on Exposé, Tony Akinyemi. What we need, like we normally say, is not more medication, but more education. And we have an authority here today who is educating us about certain protocols and modalities that are currently available in Nigeria. And of course, these have been available in other parts of the world. He just mentioned to us that in Germany, ozone therapy is prescribed to thousands and thousands of people on a daily basis in every nook and corner. And it was very mind-blowing when you revealed that even the royal family in England do take ozone therapy regularly. And that's one of the reasons probably why they all live very long. I mean, the prince just passed on at 99 recently. Thank you for revealing that information. And also underscoring the fact that ozone therapy is quite very safe. It doesn't cause embolism. It doesn't cause any problem when administered by a well-trained professional. That can help. Good. So we want to come back to the second part of that, which is the oxygen bar. So I come to your clinic. You put oxygen in a glass for me to drink, or what? What do you mean by oxygen bar?
Earlier I had mentioned the various categories of services. Mm-hmm. So for wellness patients and disease prevention, we encourage. Actually, we don't have patients in our clinic. We have partners because we partner with you to your health.
Good.
So we encourage our partners coming for wellness program to also enjoy the oxygen bar. Mm. The oxygen bar, if you go on our website, you will see it. It is clearly displayed. What we've done, we've gotten oxygen generators
Right.
and connected it with various, containers, different containers. And for aesthetic reasons, we made them with different, flavors.
Okay.
So you have orange, then you have vanilla, you have eucalyptus, you have mentioned them. They are lined up like this. So we connect the oxygen concentrator, which is generating pure oxygen into these bubbles. And then you have a NASA cannula that you put on your nose, and you are taking fresh oxygen.
Okay.
You do it for just 10, 15, 20 minutes, you feel really great. While you are enjoying this natural oxygen that has been bubbled through various flavors, we also put you on a rocking chair that will be massaging you so that the oxygen will be circulating around the body properly. So this modality, we use it mainly for wellness, patients. And for those who are really sick, we put them through the various ozone protocols so that oxygen needed to be delivered to the mitochondria or to the cell at a faster and more concentrated proportion. So this is all about oxygen. In those days we were told about Jordan,
Right.
that had oxygen bar in his restaurant in Chicago. This is basically what you have. You don't have to go to Michael Jordan's restaurant in Chicago to enjoy oxygen bar. You can come to in-country medcare in Abuja, and you will surely enjoy this.
Wow, I can't wait to visit your clinic and see what it looks like.
We look forward to welcoming you.
All right, good. Okay, let's go on now to another thing you mentioned, which is Undermed. I have actually interviewed Dr. Sylvia Binder on that before, and I'm happy that your clinic is one of those clinics in Nigeria that has the Undermed device. Would you like to talk to us about the Undermed and the various applications and those who can benefit from its use?
Yes. Undermed is a German device. It was developed 26 years ago and is being used, globally. The principles of Undermed is this: it diagnoses and at the same time treats. So we said Undermed diagnosis and treatment. Now, if you see, our body is made up of different electromagnetic fields. In fact, if you look at life, life has two properties. You have the chemical properties and you have the physical properties. What conventional medicine or allopathic medicine looks at mainly is the chemical properties.
Right.
It's trying to see which chemicals have gone wrong in the body. But the physical property is based on energy. And it's very, very important, based on electromagnetic field. Simply put, disease, when you look at the energy concept or physical properties of life, is nothing but a disbalance in the autonomous nervous system.
Right.
You have the sympathetic and the parasympathetic.
Right.
What the Chinese will say, the yay and then the nay. Yeah. Okay. Thanks, Tony. So, what Undermed does is to generate this low frequency, that goes around your body. And if you look at about the concept of energy medicine, is what you use in things like CT scans, MRI, and then X-ray. The only difference is that these ones are of a higher frequencies that may create or induce some damage. But Undermed is made up of lower frequencies. That when it goes into the body and then based on electromagnetic frequencies and electromagnetic field, detection, then it can pick some particular areas. This German technology has 174, programs.
Right.
That when you are being scanned, it goes through all these 174 programs. It operates on 4 modules. You have module 1, module 2, module 3, and module 4. Thanks, Dr. Binder, Sylvia Binder, since she's been partnering with us, she has trained our own local, physicians and certified them. They're able to do undermed now very, very well.
Right.
So let's take module 1. Module 1 is the one that goes in and scans your body through these 174, programs, different areas, different organs, and different sites. It will pick up some problem areas based on biofeedback detection. Right. And you will now press, and it matches to a particular program. Using module 1, take for example, you may detect over 16 or 20 programs. It's based on electromagnetic frequency detection and the frequencies. What they do, they use the radial pulse, detection. And based on the strength of the amplitude, they are able to know which area has a problem.
Right.
So then you go to module 2. Module 2 kind of refines and then narrows down. Supposing you pick 20, module 2 will just pick about 6. Those will be your major areas that needs to be treated.
Right.
You go to module 3. Module 3 also has, it is actually this in a microbial, program. It is able to pick disease up to the level of bacteria.
Okay.
Into our clinic and were able to he was poisoned, and were able to pick botulinum, and it treated him and he went free. Salmonella, streptococcus, all of them, even it has the adenovirus in it.
Wow.
Then module 4, that is nutrition. Like if you're any of vitamin B deficient, it will pick it. Sadly, zinc deficient, it will pick it. So undermed in summary provides a diagnostic tool and a therapeutic, based on this, explanation. It is just wonderful. It's unbelievable. Don't talk. Just sit on undermed, and they should not be confirming to you that you have pain here, you have problem here, you have scar tissue here, you have this, and you just be confirming.
Isn't that wonderful? Like just sitting in front of a device without saying anything, and the device tells you what is wrong in your body. That's amazing.
I would have just joked by saying that he must have been a veterinarian that.
Yeah, that's a good one. A good one. Yeah. Okay. Before I ask my last question, this is my penultimate question now, and that is the question I want to ask about. If somebody doesn't have any medical condition, I am not sick, I don't have any diagnosis, I don't have any problem, I just want to maintain wellness and well-being. I want to be proactive. Do you have services to attend to people like that who can just walk in and say, hey, I want you to just attend to me. I'm not sick, but I don't want to be sick. That is one question I wanted to address when we come back from this short break. The second question I wanted to also address is how do you see the role of the federal government of Nigeria, for example, in encouraging complementary, alternative, integrative, medical protocols into conventional mainstream medical practice as it is done in a place like Germany, for example, where people don't look down and degrade other modalities, and we are open enough to say, okay, we have found this to be good, let's integrate it into medical practice. That one is good, let's integrate it. For example, I will expect that ozone therapy should be available almost in every hospital in Nigeria. I saw one in one university in California, which is a little bit very, complex. It's like a whole room And people with wounds, very big wounds that will not heal for a long time, they just go in there, they sit down in the ozone chamber, and they are reading a book, and in a short while, their wounds, wounds that wouldn't heal for months and years, it just gets healed. I would expect that such things will be available, hyperbaric oxygen chambers and things like that, but we don't have them around here. I want you to address that when we come back from this short break. Viewers, don't go away. We'll be back shortly after this break. Thank you. Welcome back. This is Exposé, brought to you by the Shepherd's Flock International Church. We are honored to have Dr. John Tor in the house today, who has been shedding light on ozone therapy, oxygen bar, undermed, and the various modalities and protocols and services available at the in-country medical clinic in Abuja, Nigeria. He has promised us that as time goes on, we will have in Lagos, we will have in Port Harcourt, we will have in Kano, we will have probably Maiduguri, other parts of Nigeria. Already, it's also available in Cameroon through his partner in Cameroon. For those of you who are in Cameroon, you can actually check that out and be able to take advantage of it. Those who are in the US, Canada, and other places like that, you already have access to these services where you are. But we're talking about those of us in Africa where this is novel. This is almost new to us, but we thank God that now we can have them. So I want you to help us address the last two questions that I mentioned. Number one, somebody who is well, who is not sick, but who is just being proactive. He walks into your clinic. What services do you have for such people?
Well, very good. Our number one service is well-being and disease prevention. But we advise you, when you come in, you tell us you are well. Remember, WHO defined, health as not just being the absence of disease, infirmity. You can be going about feeling you well, and this is why we advise you that let's do the comprehensive blood work, at least. That now gives us the assurance to say that look at your parameters, they are looking great. Congratulations, continue to do what you are doing. Right. But if the parameters come different, you will also see it. Then based on that, we would advise you. That is why we now upgrade your status from wellness to disease management status. So, but if all goes well, and then you came as you said you are well, and the comprehensive test also confirms that, we now encourage you to be doing life. The body is just like a car, Reverend Tony. You can't just buy a car and just keep it and then be riding it new after 10 years. It will not be the same. You need to service it.
Right.
So we show you how to service your body. One of the easiest things to do these intravenous infusions, nutritional infusions that I had talked about. You do that maybe once monthly, depending where we met you, and depending where we, from the lab analysis, we saw the level you are. There is what we call low normal, and there is high normal, or even middle normal. So based on this, we would advise you, say, look, you are a candidate for monthly maintenance. Come to us every month for your intravenous infusion. Come to us every month for your undermed, treatment and diagnosis. Because undermed is very effective in being, it actually boosts the increase or immunomodulates your immune system. Undermed also it has some anti-inflammatory, properties. Undermed also increases the lymphatic flow that upgrades your immune system. Undermed also increases your metabolic rate. So if you are doing undermed just once a month, and you are doing intravenous once a month, then that can keep you a long way to go. So there is also this, detoxification. We also encourage even people who are well to do what we call the coffee enema detoxification.
Right.
It is really very important because you don't want to allow your body, yourself to accumulate before you start going through the process of disease management. You can maintain yourself like this and you'll be fine. So that is the kind of advice we give, and that is what the various services that we have in place that can help you attain your goal.
Thank you very much, sir. I said I was going to ask one last question, but before I ask that one last question, I want to ask, can anybody who has any of the dementias, maybe Alzheimer's, maybe dementia, maybe or any of those neurological diseases, like anxiety, and then fungal infections like mold, for example, do they benefit from your therapies?
No doubt about that. Perfectly well. Right now, I'm telling you that we undertaking patients who came in with, Parkinson, disease. We undertaking patients with, cancer. We have diabetes patients based on those what we call the fundamentals of disease management.
Right.
We go to and I say that our protocol, minimum of our protocol is about 90 days. The rationale and reason behind the body has over 60 trillion, cells, and at the end of 90 days, these cells are actually replaced. So we believe when we started with the old cells or sick cells, at the end of 90 days, you would have been rejuvenated, for a new person. So with these modalities, functional modalities in combination, we're able to handle almost most disease, conditions. The only thing we don't handle is acute care. We don't do acute care. When you come in with acute care, that is where the integrative aspect comes. We send you to conventional medicine, to go and knock you down to a level where we can manage you over the, time to recreate you and then make you reverse where you were. To come back. So it is very important. Another thing we don't play with, you cannot come to us with a fracture of the femur, and then we say, we're going to use integrated medicine. I send it to my surgeons. The surgeons tell them that is their own job, that they know how to do it better. But in terms of integrative medicine and how to manage this, we are the experts.
Thank you very much. One more. You are in Abuja. Yes. Somebody, for example, is in Port Harcourt. How can the person do 90 days? Do they have to come over to Abuja and spend 90 days there?
No. Tony, the way it works, is the level of intensity. We start. It is like a plane taking off.
Right.
You have to ground very fast at that speed. Then you maintain that attitude.
Right.
So but on average basis, those disease people or problems or our partners, you are looking at spending at least the first 2 weeks with us, so that we bombard you with this to a level where the body picks up, and then we can give you the oral supplement. Let me also use this opportunity to comment very briefly. People ask, why intravenous infusion? Why do you give high dose this? Let me give you an example with vitamin D. The normal levels of vitamin D required in the body is about 30 to 100 nanograms per milliliters.
Right.
Most of the patients that comes to us, some of them are even below 10. And clinically, it should not be less than 70 nanograms per milliliter. So that kind of level, if we don't give intravenous, and we give mega doses of vitamin D,
right,
so that they can bump you up, then you can maintain, I can maintain you on oral dose.
Okay.
So by the time you come to us, we give you that injection, then I can give you the oral dose that you can go back and then be taking. And then you come back and check, have you gone up or far? Have you gone up? So this is it. Not that you necessarily stay with us for that period of time consecutively. No.
Good. Yes. Final. The role of the federal government of Nigeria in integrative medicine and what have you.
Let me start on a very positive note. I must applaud and commend the effort of the federal government. The Ministry of Health has a department of traditional, complementary, and alternative medicine. Yes, of
Good.
which I am one of the technical and expert committee members and
Oh,
advisory members.
wow. Wow.
Yes. Very soon you're going to see that we're going to start up a college of traditional, complementary, and alternative medicine. That college was started some time ago, but it kind of fizzled out. But we've reconstituted a committee, and we, the advisors, are advising the government on how to go about this. So that is number one. So that is a positive sign.
Right.
Then, even if you talk about some of these modalities, let me tell you, we used to say that we have 5 undermed machines in the country, 2 in Lagos, 2 in Abuja in our clinic, and 1 in Federal Medical Center, Bida.
Right.
Now, the country has opened up a wellness center. They have acquired a unit of undermed, which Dr. Silva Bida is operating. So, it is looking good. It looks like we're heading in the right direction,
Right.
because the future of medicine is in integrative medicine.
Right.
Undermed is also known as energy medicine or third generation medicine. That is where we're going to do. You can imagine there is no invasiveness, and you are diagnosed and then treat. What else are you asking? Or what else do you? So this is what we're having. And so the future really holds great. The federal government is really strongly and well supporting complementary and alternative medicine, hence integrative medicine. But note, there is a difference between integrative medicine and alternative medicine. What I tell people that alternative medicine is not integrative medicine, but integrative medicine is integrative. In your introduction, you had said excellently that integrative medicine, we work with acupuncturists, but acupuncture, we just like to work alone. But we work with them. If I have a case that I know that my patient will benefit from acupuncture, I'll invite the acupuncture person to come in and apply that, as well as I use my other integrative, modalities, the ozone, the undermed, the oxygen, up and that. Yes.
Thank you very much. Thank you very much. Thank you very much. Do you have a final word for our viewers before we go?
Well, I want to really thank you before the audience for the wonderful work that you are doing. Remember, I told you that the phrase that you use is not that we need more medical prescription, but we need more knowledge.
Right.
An educated and enlightened man is really empowered. No matter amount of medication you take, you are not sleeping right, you are not drinking the right amount of water, not doing the right exercise, not doing intravenous, doing food supplementation, and all the host of others, you would not be a well person. But if you are doing all these things that I have described in integrative medicine, you will be a well-being person. So I think the opportunity like this is highly appreciated. And I pray that God will continue to use you in your ministry as you reach out to people. And I'm proud to be a part of your efforts. May God bless you.
Amen. Thank you very much, Dr. John Tor, for being with us for 2 episodes. We do not take that for granted. We appreciate your readiness to share information, and we thank you once again for setting up in Nigeria and in Africa in general. Ladies and gentlemen, it's been a wonderful evening. Please help me put your hands together for Dr. John to appreciate him. And we thank you also for spending time with us this evening. This has been Exposé, and we remember all the time, we must remember all the time, what we need is not more medication, but more education, and the best prescription is knowledge. Thank you very much. Have a very wonderful evening. Please help us tell your friends to subscribe to our YouTube channel, and also like us on Facebook and follow us on Instagram. This is being transmitted simultaneously on all 3 platforms at the same time. Thank you. God bless you.
Thank you.
My name is Olanike Aladeshuyi, a graduate of Rafa Institute of Healthy Living, a school run by Reverend Tony Akinyemi, where we are taught how to take care of our health using basic healthy living principles. My coming into contact with the school has changed my life for the better. Prior to that time, I had been diagnosed of arthritis. I had pains all over me. I had difficulty in breathing. But since I decided to take the principles taught in the school seriously and I followed them, I discovered that my health has improved. I am free of pain. My breathing has stabilized to such an extent that I can run a gym. Can you beat that? So, I want to invite you. Come, join us at Rafa Institute of Healthy Living. Let's learn together how to reverse supposedly irreversible diseases using nutrition and lifestyle. All are basic principles. Your life will not remain the same again.